Hello, I'm Dr. Hilary Jones, and I'm pleased to say that I'll be working with your co-op pharmacy to help and support with lots of healthcare matters that might crop up. Today, I want to talk about all the steps you need to consider if you're thinking about quitting smoking. Now, there's never been a better time to stop smoking. So if you're serious about quitting, then I'm going to be talking about ways that will help you succeed in your ambitions to do exactly that. Smoking is bad for us simply because inhaling any harmful substance is bad for our health and has implications for our future. Smoking doesn't just affect the health of our lungs either. Smoking can affect almost every single different organ in our body, our heart, our skin, our digestion, etc. And there's a big difference between the things in cigarette smoke that are carcinogenic, in other words, can give you cancer, and those things that make you addicted to cigarette smoking, nicotine. Nicotine, whilst addictive, is not a carcinogen. It doesn't give you cancer. But there are about 4,000 toxic chemicals in cigarette smoke which can combine to contribute to heart disease and to cancer, as well as respiratory problems in the future. There are so many dangers involved with smoking cigarettes. I've said that it can affect nearly every organ in the body. Let's just run through some of them. Everybody knows that lung disease is a consequence of smoking. In fact, 84% of all lung cancer deaths are seen in people who've been long-term smokers. Then there's the heart and your circulation. Carbon monoxide is just one of the toxic substances in cigarette smoke that can constrict blood vessels which supply the heart muscle with oxygen. And there are many other toxic substances which combined can affect your heart and your circulation in many, many ways. And we know that most people who have heart disease, coronary heart disease, or many of them have been smokers in the past. Then there's the mouth and the throat. We put cigarettes to our mouth, and there's no doubt that cigarette smoking contributes to cancers of the lip, of the tongue, of the throat, of the sinuses, and of course the gullet and the lung tissue itself. Then think about the brain, probably the most important organ in your body. Smoking increases the chance of you having a stroke by 50% or more. Then reproduction. Families who want to conceive a child, start a family or expand their family. In men, impotence and erectile dysfunction is a major consequence of smoking. In fact, about 120,000 men under the age of 20 and 30 will be affected by some degree of erectile dysfunction as a direct consequence of smoking. And in women, we know that smoking can reduce fertility per se, but even when a woman conceives, if she smokes, she's at greater risk of having a miscarriage, of having a premature birth or a stillbirth, and a cot death, even after the baby's born. Your skin can suffer. We know that aging is a consequence of smoking because the collagen, which is the elastic scaffolding tissue underneath our skin, is diminished by smoking, and so the skin looks older and you get more wrinkles. Stomach is affected by smoking as well. We see an increased amount of acid reflux, of stomach cancer, and of gastric ulcers in people who smoke, and the kidneys too. We know that smoking creates a significant risk to the kidneys. You're 1.5 times more likely to suffer from kidney disease if you smoke 10 cigarettes a day, and twice as likely if you smoke 20 or more cigarettes a day. So I'm hoping that this conveys the message that every organ in your body is affected by smoking, and if you can stop, your whole body will recover to a large extent. Well, passive smoking and the second-hand smoke, which other people around you inhale as a result of your smoking, is harmful. There's no question about it. So whether you smoke cigarettes or a pipe or a cigar or a roll-up, you need to know that most of that smoke actually goes into the air around you, not into your mouth and into your lungs. And breathing in that secondhand smoke increases the risk of lung cancer and of heart disease and strokes in the people that breathe that smoke in. In children, it doubles the risk of getting chest illnesses. It increases the risk of ear infections. It increases the risk of pneumonia and wheezing and asthma, to name just a few. And those children also have 3 times the risk of getting lung cancer later in life themselves compared to children who live with non-smokers. So it's worth thinking about those other people, the people around you that you love most, when you continue to smoke. A lot of people say, I've been smoking for years, the damage is already done. What harm is there if I just continue? Is it worth giving up now? Well, the answer is it's never too late to give up. You will reap the benefits and you'll feel a lot better in quite a short period of time. And when I say that, let me quantify that. Let me tell you why it's worth quitting. After just 20 minutes, your pulse rate gets slower and returns to a more normal level. After 8 hours, nicotine and carbon monoxide levels have reduced by more than a half, and oxygen levels in your blood have returned right back to normal. After 1 day, just 24 hours, there's no nicotine anymore in your body, and after 72 hours, your breathing will feel easier. Your bronchial tubes will be more relaxed, and your energy levels will be starting to come back to where they should be. In 3 to 9 months, so a little way down the line, coughing, wheezing, and breathing problems have all improved as your lung function increases by more than 10%. And after a year, your risk of heart disease has gone down to half compared to a person who's still smoking. After 10 years, the risk of lung cancer falls to half that of a smoker. And finally, after 15 years, your risk of a heart attack is the same as someone who's never smoked at all. So the sooner you quit, the more quickly you will reap all the benefits of better health. There are different ways of quitting smoking. A few people can do it with willpower alone. They just decide that one day they will stop and they will stay stopped. It's called cold turkey, as you know, but it's very difficult. The problem is that nicotine, which is the addictive substance in cigarettes, gives you those cravings, and they're very difficult to fight in someone who's smoked a considerable amount of cigarettes for many years. And that's the tough thing. But the good news is that there are many products which can replace that nicotine to stop those cravings and enable you to give up smoking. What's important to realize is that if you don't succeed the first time round, don't say to yourself that it can't happen. You will be able to succeed, as many people do, even if that first attempt to quit fails. Now, there are several treatments available to help you quit smoking. We talked about nicotine being addictive, so there's nicotine replacement therapy. And you can mix and match the various different aids to suit your own needs. There are prescription-only medicines. So with these, like Champix, they're only available on prescription, and they can be prescribed through the Co-op Pharmacy's online doctor service. Champix works in 2 ways. First of all, it does reduce those cravings for nicotine, just like normal nicotine replacement therapy. But it also, because it works centrally on the nervous system, it blocks the rewarding and reinforcing effects of smoking. It's taken as either 1 or 2 tablets a day, and you should start taking it a week or 2 weeks before you try to quit. Then there are the nicotine replacement products themselves. So these products can be purchased directly without the need for a prescription from your doctor. They release nicotine in a controlled manner which helps prevent those cravings which make it so difficult to quit. They come in many different types of treatment forms. So there's skin patches, there's chewing gum, there's inhalators, which look like plastic cigarettes. There are tablets, oral strips, and lozenges. And there's also a nasal and mouth spray. Now, the patches release nicotine into the body through the skin very gradually. And some are worn all the time, and others should be taken off at night. So read the instructions carefully. There's the inhalators, the gum, and the sprays. These act more quickly and might be better for helping those instant cravings. Now, NRT, nicotine replacement therapy products are most effective when they're used in combination. So an all-day patch together with a fast-acting option gives you the option of treating those instant cravings if the background ones are diminished. And something like an inhalator or a lozenge is good for those instant cravings. So ask your pharmacist in any doubt for advice. And treatment usually lasts between 8 and 12 weeks. It's not a sudden fix, it's a gradual fix. Before you gradually reduce the dose and eventually stop, give yourself that time because you will probably need it. Then there's also e-cigarettes. Now, they're available in vape shops, some pharmacies, and other outlets, of course. And e-cigarettes aren't risk-free totally, but they are generally considered to be at least 95% safer than smoking tobacco cigarettes, the conventional cigarettes. They're particularly effective when combined with face-to-face support. So that's talking therapies to help us support and motivate people as well. A treatment will normally last around 12 weeks, but it can be continued for longer if necessary. And the dose of nicotine can be gradually reduced as well. You'll have to undertake an online consultation to make sure that the product is right for you, but that's only right and proper. Now, it's really interesting that since we've been going through this awful global pandemic with COVID-19, more than 1 million British smokers have kicked the habit since the start of the crisis. That's what a charity has estimated. Action on Smoking and Health, ASH, has calculated that 1,036,000 smokers and recent ex-smokers had quit or continued their abstinence since coronavirus cases started circulating in the UK. The charity surveyed more than 10,000 people across England, Wales and Scotland, including 1,700 smokers and people who'd quit in the last 4 months. And this is what they found. They found that young smokers were more likely to have stopped than older smokers. 17% of smokers and recent ex-smokers aged between 16 and 29 said that they'd quit, compared to 7% of those older than 50. And 13% aged 30 to 49 also quit during the pandemic. So that's really good news. And I think that people have been focused on their health and what they can do to stay healthy in the future during this crisis. Is focus people's minds on perhaps how vulnerable people are. We've always assumed that infection is controllable and doctors can sort out these kind of issues, respiratory issues, but we've been made quite anxious at times by the fact that this virus is extremely transmissible and very virulent, renders people hospitalized and takes a significant number of lives. So I think this has been a great opportunity to say, do I really need to be doing anything to my body that is making me less healthy? And I think that's one of the reasons why so many people have been able to quit. And if it's taken that motivation, it's a shame that it's taken a pandemic to do it, but in a way, it's at least one positive bit of news that we can take going forward. And I'd say to other people, my advice would be, think about other things you can do. I know that a lot of people are drinking too much during the pandemic since they've been self-isolating. So keep that down to a moderate amount, stay within the guidelines, exercise more, as many people have done, eat healthily, and just think about the things that you can do for your mental health as well, to avoid too much anxiety and stress. Keep things in perspective, share your feelings and your emotions with those people close to you. And if you see somebody else who's becoming withdrawn or a little bit moody, put your arm around their shoulders, talk to them, support them, because it can make a huge amount of difference just for them knowing that somebody cares. We can all do our bit. Well, we know that our heart and lungs will be healthier when we quit smoking. What other benefits are there? Well, there are many, actually. First of all, your sense of taste and smell will return. So you'll be able to appreciate all those lovely flavors and textures of the food that we love to eat. You'll have a better sex life because blood flows around the body more easily, and there's increased sensitivity as well with lovemaking. Stopping smoking improves fertility. Men's sperm count tends to rise after quitting, and the womb lining is improved as well, and it increases the fertility in women. And finally, if you want to quit smoking for cosmetic reasons, because I think we all know that we can tell a heavy long-term smoker by the wrinkles on their faces, there's no doubt that we improve our appearance. The skin looks better. It's got a better circulation and a better tone. It regenerates some of its elasticity more easily. And then, of course, you've got whiter teeth and healthier gums as well. So there's a lot to be said for giving up smoking, quite apart from the obvious health reasons.